Arthritis is the loss of cartilage, and when we talk about the shoulder, it's loss of cartilage on the ball and socket, or the glenohumeral joint. So in order for the ball to turn well in the socket, you want that joint to be well padded and well cushioned. And when you're young, you enjoy good motion at the shoulder, the ball turns easily in the socket. As you wear out the joint, as you lose that cushion, you develop arthritis in the shoulder. And so people who have arthritis will start having pain, sometimes they'll have some stiffness, and they'll lose some motion. In athletes, we see glenohumeral arthritis in predominantly those who participate in overhead sports. Tennis players, softball and baseball players, some volleyball players will get this. We see it sometimes in contact athletes like hockey players, football players, because of injuries to the shoulder that predispose them to develop arthritis, which may be better classified as post-traumatic arthritis. I think that most people reach a certain point where they're doing the same thing over and over, they're getting the same pain over and over, and either they or a loved one finally encourage them to take that extra step and find out what's really going on. But I would say it's the pain, more than the stiffness or the loss of motion, that brings people to my attention. Like all types of arthritis, if you can get people's pain well controlled, if you can get their shoulder stronger, moving better, they'll enjoy some relief from their symptomatology. If you can use oral medications and occasionally injections, that may make them comfortable enough to continue to engage in sports, to do the things they like to do, without any intervention whatsoever. Now there's some evidence that says you can use other injectable medicines into the shoulder to help keep it moving, but those are somewhat preliminary and remain to be seen. So if you've heard of Synvisc or hyaluronic acid, those are injectables that are used in the knee predominantly, but sometimes can be used in the shoulder to treat arthritis, to try to keep the joint healthy, to keep it nourished, and the pain under control. As you can imagine, it's a two-sided joint. There's a ball that turns in the socket, and depending on how your arthritis is formed, what the demands are on your shoulder, and what you hope to do after surgery, you can address either the ball, the socket, or the ball and the socket. And in that case, there's a variety of different implants, predominantly metal and plastic, that can be used to make the most of what's left behind. It's really a matter of resurfacing, like retreading your tires, where you recover the ends of the bone so the rough surfaces become smooth, and the things that were painful are no longer rubbing. After having your shoulder replaced, most people do very well. It's a very good surgery in terms of pain control, and most athletes will return to some level of competition. It's reasonable for people to go back and play some tennis, play some softball. Obviously, we ask people to avoid heavier, high-energy contact injuries that would cause repetitive load over the shoulder. So if you're looking to dig ditches or swing sledgehammers, we ask those people kind of to wait their turn until they're done with those things. But if you're an athlete, you can get back to doing most of the things you like to do: running, jogging, badminton, and tennis, having resurfaced both the ball and socket. And I'd say that's true in 90–95% of people who have their shoulder replaced. Most people do pretty well in the first 3 months. I usually allow them to get back to activity at about 3 months. One of the things that's very interesting is we see this in a lot of men who are golfers. And golf ends up being very, very good for the shoulder. It encourages a healthy range of motion, and it encourages you to have strong, flexible shoulders. So by 3 months after surgery, I'm allowing people to take simple chipping and putting, and maybe even a full swing as early as 4 or 5 months. Almost everyone's back by 6 months, but they continue to see some improvement until a year or 2 after surgery, which is obviously very encouraging. I think the one thing that people should know is that you're not supposed to suffer. So there are options to make you comfortable that do and do not involve surgery. If you're having shoulder pain, if you're not able to do the things you want to do, it's worth getting a consultation to understand the problem so you can make informed decisions. Sometimes you don't want to take medications and there are injections. Sometimes you don't want injections and there are simple modifications to what you do that don't involve surgery that can make you comfortable. But if you notice that things aren't the way you'd like them to be, you're not enjoying the activities that you once did, there are operative and non-operative modalities that can help people live the kind of life comfortably that they want.